So you talk about your muse in life. What was your inspiration for charity, and when did you really start to get very involved?
Social consciousness is really what drives me. You know, I couldn't imagine dressing people without addressing the issues, that are so much part of our lifestyle. And when the AIDS epidemic broke out, it became very clear to me that we had to create a coalition to bring that awareness. So I started Seventh on Sale along with Anna Winter, and getting all the designers, to sort of donate all their things that are hanging out in their design room. And we brought the awareness to the retailers, to the designers, to the magazines, to the public, and the consumer came in. And in those days, people were not discussing AIDS at all. So that was really, I would say, my launch into my passion for philanthropy and really bringing the two worlds together of philanthropy and commerce. And then from there, Elizabeth Glazer, who had AIDS at the time, a woman, a child having AIDS, it was sort of like, how could you? And, in those days, people didn't even discuss the word. It was the non-discussable. So we did another event that was about partying and having fun and bringing the family and realizing the awareness had to be made as a family issue, and that was amazing. And then my girlfriend Elizabeth Tabaris contacted ovarian cancer, again, a subject not discussed. We didn't even know about ovarian cancer really, and those people who had it. And I said to Liz, well, why don't we take the formula, Seventh on Sale, bring it, empty our closets, do it in the Hamptons. And today, I think it's about 15 years later, Super Saturday is sort of like the big hit of the Hamptons, where philanthropy and commerce, truly meld. So always being conscious of what it means to be a designer, creator. What does that mean, dressing and addressing? And I personally had been hit on every single level with cancer. My mother died of cancer. I don't think I'd be the person I am today had Anne not unfortunately contacted cancer. And when Anne had cancer, my daughter was born at the same time, 1 week apart. And I had a collection due. So really living birth and death simultaneously. So philanthropy and commerce was always something that was a part of my DNA. I would say dressing people and addressing their needs, not only from their outside, but from their inside. Somebody who is so constantly out there in the workforce, I realized, I would constantly be going away to find my retreat. And I would travel from New York and London, Paris, Italy, and I had a certain way of life. I was a yogi since I was 18 years old. So healthcare was something majorly on my scope and who I was. That's how I started the bodysuit. And Donna Karan that's why I used to wear yoga clothes. It starts with the bodysuit and then you put on the rest of things. And I figured, 7 easy pieces, that's all a woman needs.
You're obviously a role model for many women and young women. What's interesting to me about all that you've just said is how personal an experience you had with almost every step of the way, from your mom to people in the retail industry with AIDS, with your friend with ovarian cancer. How do you inspire people that are lucky enough not to have a tragedy right now to understand that they need to get involved? Do you find that difficult, or do you find that it's people want to do the right thing?
I think we're living in a world of chaos right now. And I think that's where the name Urban Zen came from. Where do you find the calm and the chaos? I don't think we're just, as a designer, I just can't look at dressing people. It had to be far more than that. I don't think there was a customer who would come into my store who said, my mother has this, my father has this, my this has that. The one thing in putting Urban Zen together, I looked at the universal thing that was missing. And that was the mind, the body, and the spirit. And I think of Urban Zen as a place and a space where people can come together, just as we're doing today, who really want to create a change. And this is not about me, Donna Karan. This is about the we. We have problems out there in the world today, no question about it. So how are we going to make the change? we can't keep pointing the finger at the government and saying they're going to do it. Those three fingers are back at me. It's my responsibility. It's my responsibility as a designer. It's my responsibility as a mother. It's my responsibility as an activist, as person in the industry, but of a citizen of this world, and somebody who's been so inspired by the world, and from one level, also is disillusioned by what is happening in the world today. And I felt that the only way that this can happen, and I had been very involved in the Clinton Initiative, and really President Clinton was a major inspiration for me for Urban Zen as well, where we all got together and looked at the world as one. And I said, well, how are we dealing with this on a domestic level? And for me personally, and this is where the personal aspect came in, is I lived in a hospital practically my whole life, but as the loved one, not as the patient, and also as the patient, and realized there was absolutely something wrong with our hospital system. Where was the care in healthcare? We were treating disease, but we weren't treating the person. We weren't treating the loved one. The nurses are being burnt out. The nurses are now the doctors, and the doctors are, you are a lung, you are an ear. When I grew up, there was holistic, family doctors. There's nobody like that anymore. So as a person, everyone gets hit by healthcare. Nobody gets away with this. So is this something that is personally mine? I think this is personally every single person in the world. Nobody's getting away with this one. We're all going to be in a hospital at some point in our lives, either as a loved one and as a patient. And there is something definitely wrong in our medical system. And together, I identified it. My husband, who had cancer, and I lived with that for 10 years, I had the opportunity to give him the tools that were missing, which was yoga. He had lung cancer, so Iyengar yoga was very helpful for his breathing pattern. Massage therapy, aromatherapy, nutrition, end-of-life care. How are we going to deal with this? And I found that in the hospitals, nobody was taking care of it. And I got really upset about it. And I said, there's something missing in our healthcare system. And I think in doing that, I realized, well, I call it past, present, and future. It's the wisdom in the past that we have to hold on to that we're so losing. When I think of yoga, I've been a yogi since I'm 18 years old. So that's an old wisdom. And I want to preserve these wisdoms, and I'm afraid in this globalization of world that we're living in today, we're forgetting the true essence of our cultures.
So if you had only one issue that you could give money to, you had one issue that you could put at the forefront, would it be healthcare? If you could only...
I find that I cannot separate healthcare and education and using the tools from the culture. Because if you think about it, the mind, body, and spirit, if I look at it as mind, body, and spirit, it's what's missing in healthcare and it's what's missing in education. It's the two tools. For the future, we have to teach it at an educational level, so we will be prepared for the present where we're dealing with it in healthcare. So I would have to look at that as what are the missing elements that are missing in our healthcare system and that are missing in the educational system. We teach reading, writing, and arithmetic. We teach disease and care. But who's taking care of the whole person? That aspect is definitively missing in both healthcare and education.
Is there a mistake that you've learned from? You've obviously been doing some sort of philanthropy pretty much your whole life. Is there some word of caution?
Every day I learn.
Every day.
I mean, I would love to say, I think this is probably the hardest thing I've ever done in my life. I think there are, unfortunately, a lot of the me's in the philanthropic world and not the we's. We say that there are the we's, but it is difficult to find like-minded people who really want to come together. It's a very competitive field, and I find that very taxing, because you only have X amount of hours in the day. and have to prove to everybody, is it clinically tested? How do we get it tested? Start it with one hospital, and I see, oh my God, there's an emergency happening here. This is a major problem that we're all going to be affected with, and I get calls every single day. My daughter, my husband, my family. And once you open that door, you can't close it. It's like when I went to Haiti, and how did I get involved in Haiti? And Haiti was a perfect example for me, because Haiti held the preservation of its culture, healthcare, and education. My 3 points all sat in the developing world. So when I took on Haiti, I realized that what I was looking to do is creating a model community where healthcare would be there, the proper education will be there, and develop a conscious community, which is what urban Zen for me is all about. It's not about me. It's about creating a community of change, having that community in New York, having it in LA, having it in San Francisco, and allowing the people to be the activists of change. This is a model, and it's like the iPhone or web. I mean, it's not all about me. It affects every one of our lives. And so I feel that, it's social responsibility that we all have to get involved in this and make the change.